Wait. Did you know your body might be sending you subtle signals about serious health issues? One of the most overlooked warning signs could be in something as simple as a smell. Yes, certain odors can be red flags for cancer, and many people miss these critical clues. Today, we're going to explore 8 smells that could potentially signal cancer and why it's vital to pay attention to them. Some of these might surprise you, but being aware could save your life or the life of someone you love. Let's dive in. The science of smell and cancer. Before we jump into the specific smells, let's talk about why cancer might have a smell. Our bodies constantly release volatile organic compounds, VOCs, through breath, sweat, urine, and other bodily fluids. These compounds change when there's an abnormal process, like cancer, occurring in the body. Some cancers produce specific compounds that give off distinctive odors. While these smells may not always be strong or obvious, they can be an early warning sign that something is wrong. Paying attention to unusual or persistent odors could be a game changer. The 8 cancer-associated smells to watch for: 1. Foul-smelling breath, halitosis. Persistent bad breath isn't just a dental issue. It can sometimes indicate cancers of the mouth, throat, or stomach. In some cases, cancer cells produce sulfur compounds, leading to a rotten egg or metallic smell. If regular brushing, flossing, or mouthwash doesn't help, it's worth getting checked out. 2. Sweet or fruity breath. While a fruity smell on the breath is often linked to diabetes, it can also be a warning sign of lung or liver cancer. Certain tumors can disrupt the metabolism, causing an accumulation of ketones that produce this distinct odor. 3. Rotten smell in sweat. If your sweat has taken on a strong, rotten, or sour odor that doesn't go away even with good hygiene, it could be a sign of certain cancers such as lymphoma. The body's immune response to cancer can change the composition of sweat, resulting in unusual smells. 4. Fishy smell in urine. A fishy smell in urine is often associated with infections, but it can also indicate bladder or prostate cancer. These cancers can alter the balance of bacteria in the urinary tract, leading to persistent odors that don't resolve with standard treatments. 5. Fecal smell on breath. A fecal-like odor on the breath can be linked to gastrointestinal cancers, such as stomach or colon cancer. This odor may occur if the digestive process is disrupted by a tumor, causing undigested food or waste to linger longer than normal. 6. Musty or moldy. Smell on skin. Certain skin cancers, like melanoma, can produce a musty or moldy odor. These smells are caused by the breakdown of skin tissue or secretions from tumors. If you notice an unusual smell on your skin that persists, it's essential to have it evaluated by a doctor. 7. Metallic smell. A metallic smell, either in sweat or breath, can sometimes signal lung cancer or certain blood cancers. These cancers may release iron-related compounds, which create this distinct metallic scent. 8. Strong body odor. Changes. Any dramatic and unexplained changes in body odor should raise a red flag. For example, breast cancer can sometimes cause the sweat glands around the chest area to release unusual odors. Hormonal shifts caused by tumors might also alter the way your body smells. Why do we ignore these smells? Most people dismiss unusual odors as temporary or unrelated to health. Here's why. 1. Normalization. Over time, we become accustomed to our own body's smells and might not notice gradual changes. 2. Embarrassment. Many people avoid discussing smells because they're embarrassed. 3. Lack of awareness. Few people realize that smells can be an indicator of serious health issues like cancer. By raising awareness, we can change this mindset and encourage more people to seek help when they notice something unusual. What should you do if you notice these smells? If you detect any of these unusual smells, don't panic. Instead, follow these steps. 1. Monitor the smell. Take note of when it started, how long it lasts, and any accompanying symptoms. 2. Improve hygiene. Rule out simple causes by ensuring proper hygiene and hydration. 3. Consult a healthcare professional. If the smell persists or is accompanied by other symptoms like fatigue, weight loss, or pain, schedule a visit with your doctor. 4. Be honest. When speaking with your doctor, don't hesitate to mention the smell. It might provide valuable clues for diagnosis. The role of early detection. Catching cancer early significantly improves the chances of successful treatment. Many cancers are treatable and even curable if detected in their initial stages. Paying attention to your body's signals, including smells, can play a crucial role in early detection. Real-life stories. Here are 2 inspiring stories of individuals who noticed unusual smells and acted. 1. Sarah's journey. Sarah detected a persistent metallic smell in her breath and decided to see her doctor. Tests revealed early-stage lung cancer, and she's now cancer-free after treatment. 2. John's vigilance. John noticed a fishy odor in his urine that wouldn't go away. His proactive approach led to a diagnosis of prostate cancer, caught early enough for effective treatment. These stories remind us that paying attention to small changes can have a massive impact. Myth-busting. Let's address some common myths about cancer smells. 1. Myth: all cancers produce odors. Fact: only some cancers cause detectable smells. Second myth: smelling something unusual always means cancer. Fact: many odors are caused by benign conditions or lifestyle factors. Third myth: you can rely solely on smells to diagnose cancer. Fact: smells can be a clue, but should always be followed up with medical tests. Conclusion: your body is constantly communicating with you. By paying attention to unusual smells, you might catch an early warning sign of something serious, like cancer. While it's easy to dismiss these changes, being proactive could save your life or the life of someone you care about. If you've noticed any of the odors we've discussed, don't hesitate to act. Share this video with friends and family to spread awareness, and don't forget to like and subscribe for more life-saving insights. Stay safe, stay healthy, and remember, when in doubt, get it checked out.